practices for insurance verifications and re-verifications, and then tracking insurance eligibility within Healthy. I'm going to start off by setting up your insurance settings in Healthy. Now I'm going to do a screen share on some of this afterwards. Actually, it might be easier if maybe I do it after I go over this. So, setting up your insurance settings in Healthy. Okay, you'll go to your settings, insurance settings, and then check the following settings are enabled. Your track client insurance eligibility, your CMS 1500 claims. If you have Office Ally as a clearinghouse, then you want Office Ally integration. But if you don't, or if you're looking to change, Claim MD is coming and hopefully really soon. We're all excited about that. And then the super bills marked as well. Your billing provider needs to be added. Add your billing NPI, your business name and address, and then the accepted policies. So this is where you'll enter the insurances you take and make sure you have the correct payer ID. So let's go ahead and I'll exit out of this and show you Healthy where you'd go for this. So where you go here is in settings, right? And then you want to go into the, sorry, I'm trying to move these pictures around. Okay. Insurance right here. And then you'll edit this. So you want to make sure that your track client insurance eligibility is on. Your CMS 1500 is enabled. And then right here is where it's going to show you how to turn those on. And if your Office Ally integration and super bills. Okay. Now, once Claims MD comes on, it should be here also. Now you want to make sure that you look at your CMS 1500s. This isn't enabled yet for you guys yet, but eventually it will be. That'll be another class at another time. Billing providers. So if you are a provider that has different provider names, then you can put them all here. If you're just one billing provider, then you'll want to add your name here, your provider name, your phone number, address, and then your billing NPI and your tax ID number. Okay, that all needs to be entered here. This will automatically populate onto your claims. Now, if you find that one of your patients has a custom policy, that's where you'll enter that here. And these are your accepted policies. So say you're credentialed with Aetna, then you want to make sure that Aetna is here. If you are with Anthem Blue Cross and say like California, New York, then make sure that you have Anthem Blue Cross here if that's who you're credentialed with. And then, Cigna, any other that you're in network with, put it here. Now, what this will do will show in a minute, but having all of the ones that you take here makes it easier for you or any admin to know what your insurance policies are. Okay, so let's go back to the slideshow. So collecting and storing insurance details, including cards and IDs. So again, I may harp on this on every class. Make sure beforehand that you have all the paperwork completed and signed from the patient. Uploading the driver's license and insurance card. We need the front and the back of the insurance card. You will need to verify that the payer ID you have for the insurance for the patient is correct. So that is on the back of the insurance card. So you want to make sure that that payer ID matches and it's on your list of insurances that you take. And then if you verify your insurance, make sure that the information is stored for both you and your patient that you see. Okay. So we in the office that I worked at, I created this form a long time ago because this was great to go back to, and I'll share it. If I haven't already shared it in the class, I don't know which class I've shared this in because I'm doing two separate classes. So you'll have to bear with me. If we're just now getting to this, then I get to show it to you. So who verifies? Are you going to verify or the patient? Are you going to have a billing company do it? Or how about AI? So there are AIs that Healthy works with that can also do your verification. So remember to keep that in mind also when you're deciding who's going to do it, you or the patient. If you're going to have your patient do it, I did create this form that I did it. So that the patient could do it. And it asks all the right questions and gets all the information. And it also holds that information within Healthy for you both to be able to see. So you need to create something, and it kind of helps to have on that. And the form I'm going to show you is, it does have that the disclaimer that states that a quote of benefits isn't a guarantee of payment. It also gives cash prices, so you're putting that there, that if the insurance denies their claim because it's not a guarantee of payment, that this is what your cash price will be. And that way you're upfront with the client on how much they'll pay if the insurance denies it. And you can also create a folder and documents that is for all your insurance verification. So we have a folder that is visible in the document section. We make visible to the patient that has insurance verification forms. And so that document is moved in there to the PDF, or there's a cleaner one you can make. And it just documents what their out of pocket will be. Um, and if there's any notes. We created a shorter version for us because we verify for the patient, and then we uploaded it for the patient. So it's a little more cut and dry. But if they're verifying it, they should have some idea of the information that you're storing there. Um, and that way they can go back to it. So if they come to you and say, well, I didn't know I was going to pay this out of pocket. Well, it's in the document section under insurance verification, and they would have gotten a notification to their email stating that you shared this document with them. So you can always go back and say, here it is, and you signed and dated it. So you shouldn't, at that point they should have known, right? So that's kind of where I was going with the always have a disclaimer about your cash rates as a best practice to protect you against the lost revenue, and an estimate of benefits is not a guarantee of payments. We put this on our paperwork. We put it in our onboarding, so they're aware, they have to agree to it, they sign it. And if you have your patients do the verification form, you can have it on there as well and date and sign it. So they are fully aware that this could possibly lead to a cash price or cash price. So let's kind of look at that form before we go into the tracking the insurance. So the form, I'll get into my patient that I'm using. This is a test environment, FYI. So, this is a test patient. Okay, so the form that I created for this patient is in here somewhere. Insurance verification form. Okay, this form right here goes through, and I filled some things out of it myself. So this patient has United Healthcare. Here's their member number. Here's their group number, effective dates, because that's important. Some are calendar year, not contract year. So contract and calendar year are different. If it's a contract year, it may start in September and then end, August. So that's important to have that there because their benefits could change from year to year. Have the insurance phone number listed, okay? If they already know who they'd like to schedule with, I had made a drop-down menu so you could put that in there so they have the NPI, the address, everything. If you have all your providers credentialed the same way, then it doesn't matter who they pick, the benefits should still be the same. And then it goes down the list of things to ask. Are we in network with this plan? Because there are some plans, say, for example, we're contracted with Aetna. We're in network with Aetna. However, Aetna has some new policies that don't credential and don't contract with dietitians. So you need to be asking this question. Either you do or the patient does, and have them look it up. Um, if we aren't in network, do they have out of network benefits? So maybe they're not contracting with dietitians, but they may have out of network benefits. Then you can super bill them, and then the patient can get that, send that off and get it paid. So that's why I'm asking that question. Um, and if they don't have out of network, you do the Super Bowl. If they do have out of network benefits, then you need to see if these services are covered. Because even if they have out of network benefits, if the services aren't covered, then they're not going to get reimbursed for it either. And then the diagnosis code. If they know what it is, this is the common one. You can look over their onboarding, or they called in and say, hey, they know why they're coming in. You can put the code in there for them so that they know what they need to ask, and have your codes listed here. All the codes that you bill with, have them here so they can ask those questions. They need to ask if telehealth and virtual are covered, and they'll ask you, are you Teladoc or MD Live? You need to say no, we have our own HIPAA compliant. Okay. Any specific codes required for coverage. So, sometimes they only take diabetes and eating disorders. So that's good to know there too, is a pre-auth required. So it just goes down the list. I don't think that we have the time to go over all of it. I think some of it is pretty self-explanatory. Their deductible out of pocket, what the patient responsibility would be if there's a visit limit, the call reference number, the name of the representative, and any additional information. And again, here's the benefit disclaimer: getting permission to charge the card on file. Here are cash prices. They sign it and then they submit it. Then both of you have that on their Healthie at all times. Okay. So now we're going to talk about how you track it within Healthie. Okay. So tracking insurance eligibility within Healthie, a client profile, the insurance eligibility, you're going to add the patient insurance ID and group number, any insurance note, great place to put the patient out of pocket copay um, amount and deductible. It doesn't have the actual out of pocket, so that's something you might want to document somewhere else, because the copay and deductibles go towards the out of pocket. So, and so did the coinsurance. So you kind of need to know what that is as well. Number of covered sessions, authorization information if this is an HMO patient. And once all the information has been entered, you then have a quick way to access this insurance information. So now I'm going to screen share this and show you where all of this is within Healthie. If you entered all of that onto, set your settings correct, this will all show up for you on the overview page. And another place is right here. So if you're in your chart notes and you don't know whether or not to pay or not, um, then you can look here. So for example, right here, you see these notes. Those are a template we created for ourselves, because say they do owe a deductible, right? Well, you need to make sure that you're collecting that deductible amount at the time of service. So you need to know what your fee schedule is, times your units, because that units is important for dietitians. It is a 15-minute increment. So if you saw them for an hour and a half and you're using units to bill, it needs to be $40 per with 6 units. So your initial visit that you should be collecting for your deductibles should be 180. So having that all for you so that you're ready to just take that payment from them is very important. So this is what we're going to discuss real quick, and then we'll go into questions. Okay, so this is all here in Healthy. So once you enter their insurance information, their member ID, the group number, all of that, it will populate here. Okay. And you're going to enter, do they have a visit limit? Is this an HMO policy? Do they have a pre-auth? So if there's a pre-auth, you want to make sure that you're marking the insurance, the authorization is required, and the auth number here. When you enter it here, it will automatically populate onto your claim. You want to put your visits, how many visits are allowed, how many are used. Now, where this gets tricky, not really tricky, but if you have an HMO policy, like for example, TRS, if you guys are in the state of Texas, TRS only allows 10 um, preventative and then 28, I think, of for obesity. Okay. What if you get an auth for 99 visits? This needs to be how many the benefits allow. So make sure that you're quite aware with what the visit limit is for your client. That's why this is kind of important. If they only have 4, then you want to make sure you only put 4 visits are allowed, okay? And then the start date, this is where that contract and year are important. Um, and you want to make sure that that is correct. For pre-auths, our office, we don't use that for regular. We actually only use the effective and start date for our HMO clients, or if they have a Medicare policy, because it's a rolling year. So if they started seeing you in March, they only have 3 visits until March of the following year. So that's what we use this for visit limits. That way we can accurately keep track. For you, a dietitian, you'd be able to be in your chart note, and before you schedule a new one, you can see how many visits they have left. You can add, once the insurance is verified, you can put preventative, if there's a copay, co-insurance, deductible, is telemedicine covered? And this is medical part of it. You put there's a $20 copay if it's a medical diagnosis, 30% the deductible amount. They've met 300 this year. All your codes that are covered. Was a referral required? So for pre-auths, we always put yes, and then you can put the referring physician, the call reference note, date and time, and then hit save. Now, the patients don't see that. They don't see this, only you do. So this is for your part, um, for you only. So when you're scheduling your appointment for the next time, you can go in here and see they only have 4 visits and they've used 3 so far. So you only have 1 left. So make sure that you're telling your patients that. That was kind of a really quick overview. We have 7 minutes for some questions. Do we have any questions?
Allie, I haven't seen any questions come in so far, but we
Mm,
can give everyone a minute to type in any questions either in that Q&A section or in the chat if you guys do have any questions, since we do have
okay.
time. If I do see question about the recording. Yes, we will send out the recording after this session along with the slide deck. Um, if any of you were able to join last week's session, I apologize. We had a technical issue with the recording, so we were not able to send it out. But fingers crossed, we expect to be able to send out the recording this week. Allie, another question. Is there a report or a quick way to see if a patient's insurance plan is expiring soon?
So that you can use that as well. If, say, for example, the you're not it's not an HMO policy, you can put it there. And uh you can run the I think it's the all client report. Let me hold on. I think we'll show you that. Oh no, actually authorization will show you that. Because we use it for our HMOs and stuff, but if you want to put in your other insurance too, you can get it off the auth report. So if you're putting it in there when it expires, it will give you this report will give that to you.
Awesome. Thanks, Allie.
Hmm.
Another question, does it confirm if your clinic is in network or not? So I think
Um,
the questions, maybe even the previous one here might be around insurance verification and identifying the
yes.
expiration date as well as identifying, yeah, okay.
Right. So when I was talking about contract year versus calendar year, if they tell you it's a calendar year, then it starts January 1 and ends January 31st. However, if they lose their job in the meantime, it could expire prior to that or something to that effect. So, if you have Alpha Ally, you could verify that it's still valid at the time of service is a good way to look at it, because we have had that, and then of course the claim denies as they've lost their insurance. So when you're verifying your insurance, you ask if is it a contract year or calendar year. Calendar year would be 1/1 to 12/31. If it's a contract year, then you need to know when that contract starts, and then you can document it somewhere so you know when the contract ends. What we did is if it was like a January, or say it was a February year. I think there's a Cigna policy that starts in February. We tagged it. So we put a tag on it that this was um a February insurance policy. So that would help you too. And you can run an appointments report and all your tags will show on there. You can use those tags as your expiration date too. So then you can run your appointments report. So when you're person that's on your appointments for the day, you can see when it starts and when it ends if you wanted to. Does it confirm your clinic is in network? No, not really. Um, that is, you have to do that during verification. You need to ask them if it's claims in network or not. And you can put additional notes in that insurance eligibility part that states that you're in network or you're not.
All right. Thank you, Allie.
Mhm.
We have just another minute or so. If there's one more question maybe that anyone has, feel free to drop it in. Otherwise, if not, if you don't have any other questions, feel free to hop off and we will see you hopefully next week at the same time for the next session, which you do again have to register for separately. Allie, I'll let you close out the slide right here.
Okay. If you guys need any more resources and support, most of you, I know all of you are on Healthy, so you just message your questions to hello at Get Healthy. Also, the Healthy University has pre-recorded tutorials out there. And in addition to, if you would like that insurance verification form, we can share that with you. If you mention that in the hello at gethealthy.com, we can share that to your Healthy and you can have that insurance verification form. You just need to change it up to your own um, office. So, and then of course, sign up for the weekly recurring live classes. And that's the address there. So it was great talking to you all, and hopefully, we'll see you next week.
Thanks, Allie. Thanks, everyone.
Thank you.